So one of the ways that we assess how the shoulder, the thoracic spine and the lumbar spine interact is to get the athletes to raise their arms over their head. What you'll see here is Oakley's lumbar spine is extending because he's raising his arms overhead. What this means is that the thoracic spine is tight and the shoulder range is not full, if for the fact that you'd preserved the lumbar spine range. So other things to consider also is pectoral and lats muscles are going to be tight in terms of just getting the shoulder range to be at 180 degrees. Previous injury to the shoulder will also count, and previous injury to the lower back as well. It could just be a really poor movement behaviour, or it could be a resultant factor of having immobility or inflexibility somewhere. What we need to remember is when someone is performing movement in front of you, you constantly assess that person. It's not just a formal test that you assess movement. You always assess that movement as soon as they perform movement in front of you as a coach. So the first things that I'd be doing here is checking firstly that pec and lat tightness. I would also be able to then put the athlete against a wall. So to try to preserve neutral spine whilst raising arms overhead, and to try and get a true gauge on what their shoulder mobility or shoulder range is in that flexion behaviour. And then from there, try to perform some stretching or mobilisation of the shoulder, like the capsule, the rotator cuff, and also the pectoral muscles to see if you can loosen them off to increase range of motion and whilst doing that, maintain neutral spine.